like halfway. All right, perfect. Um, okay, now let's get started.
Let's do it.
Hey everyone, Jordan here, and I'm really excited to be joined by Jimmy Turner, who most of you probably know as the physician philosopher. And he just came out recently with an awesome book that I just finished reading, actually. And I was just telling him I read it in like just a matter of a few days because I thought it was so good. But it's called Determined: How Burned Out Doctors Can Thrive in a Broken Medical System. And so, in sharing my thoughts on the book, I thought it'd be really cool to have the man himself here and kind of talk a little bit about it. So maybe Jimmy, I don't know, you can just start off, introducing yourself a little bit if anyone doesn't know you, which they probably do, and then what sort of motivated you or what was the impetus to write this book?
Yeah, I appreciate you having me on, Jordan, and it's good chatting with you as always. But yeah, so I started I started the physician philosopher in November 2017. My words got jumbled up there. And yeah, it was originally a personal finance blog, and I think I even had this it's wealth and wellness was a tagline originally, so I've always tied wellness into what I do. And then at one point it was like fighting burnout with financial independence. And then hilariously, or not hilariously, but ironically, I ended up getting burned out myself despite talking to other doctors and teaching them how to use money not to do that and to kind of fight back. And so yeah, I found out that personal finance is great, and I'm still a huge money nerd, and I still love teaching people about personal finance, but it's a tool. It's not the end all be all. It's a means to an end and not the end itself. And when I got burned out, like money didn't save me, right? And
Mhm.
so we all think, oh, financial freedom, like I can walk myself out of this and like not have to, worry about anything once I become financially free. And what you don't realize is that there's this whole thing, about purpose and connection and identity that doctors have that doesn't magically go away when you hit your number, or when you
Mhm.
have enough cash flow coming in to walk away from medicine. And so, I ended up getting super burned out myself. And that's kind of when I found coaching and learned a lot of the principles that coaching teaches. And man, like it totally transformed my life. And so I wanted to share a lot of those principles that I had learned with other people in, a very compact and organized way, to help other doctors who may be struggling in medicine. And honestly, any other medical professionals. I think this book, although it's targeting physicians, and can certainly help any medical professional. And so, I decided to write the book to do that and to allow people to, have a little bit of a step into the world of coaching and mindset work, and, using that in addition to the financial freedom that people need, kind of combining those two things to create a life that they love, whether that's, inside or outside of medicine. So that was, kind of the background, the reason I wrote the book.
Very cool. Yeah, and I think it comes through in everything you do. And I think that's, a huge part of everything you do, but especially in the book, even if someone didn't know you, you really get to know you through the book, and it comes out how passionate you are. And obviously this is something that's impacted your life and that you've worked really hard on. And, I think it's always remarkable when people are able to take sort of the jumbleness of life, because obviously you going through this was not like a straight linear path, like nothing is for anyone. But you kind of create this very nice, I'll call it a story, throughout the book. And it sort of starts off, what are the issues with the system, then what we can do to change the system, but even maybe most importantly, because that's where a lot of people stop, but you talk about, okay, the system, yes, we need to change it, but we're not just going to snap our fingers and all of a sudden it's changed. So we need to know how to work within that for now, and work on an individual level. So I thought that was really cool. Maybe you can talk about that, and
Yeah.
maybe
Yeah.
a couple takeaways, or previews for people who are going to
Yeah.
pick
Yeah.
up the
So
book.
I think that's a really important distinction that you make because one criticism of the book that people can have that I tried to really, speak loudly about is that the system is broken. I mean, that's why the subtitle of the book, is about doctors thriving in a broken medical system.
Hmm.
And so, yeah, there's probably someday going to be a second book where I address some of the systematic changes that, could be put in place in medicine to help address the burnouts that's caused by it. And so it's
Hmm.
not the doctor's fault that they feel burned out. It's this morally injurious system that leads to that individual phenomenon of burnout. So a lot of people have this conversation about, whether it's moral injury versus burnout. And I think that's a false dichotomy. I think it's both. The morally injurious system, that moral injury that comes from the system exists. And so does the individual phenomenon of burnout. And so, combining those two things, it made sense to me. Okay, I really have to deal with this giant elephant in the room, which is that people feel like the system is the thing that's broken and it's not their fault. And that is completely true. But that doesn't mean you have to just sit there and lay down and take it.
Take it, yeah.
Right? Like you do have the ability to fight back if you can just understand the tools that you have at your disposal to wield in order to do that, and to take back some of your autonomy, to create some of that financial freedom, to feel valued when the system doesn't value when you go to work. And so both of those things exist. We should be mad about the system. We should be angry about it, but we can't let it have the impact of causing us to be bitter and to feel like we can't do anything about it. And so you're exactly right. The first half of the book is talking about, what's broken in the system and how we got here. And it even provides a framework that I created that you can't find anywhere else to understand exactly what's going on, and how that impacts the individual physician. And the second half of the book is telling you, great, now that you understand how this is impacting you and how you got here, and it's giving you language to use exactly to understand exactly what the problem is for you. How can we fix it? And so that's exactly how I wanted to lay out the book, but I couldn't do that without handling that elephant in the room that so many people are aware of.
Yeah. Yeah. So, and just for people who are sort of starting it, what's like, give a couple previews of like on an individual level, ways that people can start to improve.
Yeah, so I think that the one that doctors arguably need to do, I don't know, maybe not the most, but it's definitely a huge impact, is something that most doctors do not want to do. And so first, maybe I'll explain why it's so important. So everything that you do in life and that I do in life, that any other doctor does in life, is motivated by our feelings, right? So you don't cut somebody off on the road without being angry at them. Like you don't, marry someone if you're not in love. You don't, throw a computer at work when the electronic medical record's not working if you don't, if you're not upset about it, right? Everything that we do in life is motivated by our feelings. And so Douglas Lyle had this motivational triad that basically described, you do everything for one of two reasons, which is to seek pleasure or to avoid pain. And the third component of the triad is that you try to do either of those things as efficiently as possible. That's the reason why when you're bored, you look at your cell phone, because it's an efficient way to deal with that. It's the reason why you drink alcohol when, you're depressed or anxious or things aren't going your way, to quote unquote, take the edge off. We try to find the answer for seeking pleasure or avoiding pain as efficiently as we can. That's what our brain is wired to do. And what that does, if you don't know what's going on, if you're not aware of how your feelings really drive your actions at work, at home, and everywhere, is that you just kind of go on autopilot and start doing these things that are happening because you've never really given them thought. And the reason this happens is because you don't know what you're feeling, right? So this emotional processing piece of coaching is just fundamentally important to people's success. And one way that I encourage people to do that, and I actually walk them through, this in the book, is, and as people are listening to this, I can press pause after I ask these questions. But the first one is, what three feelings do you feel on an everyday or weekly basis, right? What are the three most common feelings that you feel, right? And press pause, answer those questions, write them down. And then the follow-up question is, what three feelings would you like to experience on a daily or weekly, basis? And I've never gone through those two sets of questions ever, without people saying that they want to feel 100% positive feelings and that their negative feelings are 2/3. Very rarely it's 1/3 what they actually feel. They'll be like, yeah, I want to feel contentment and happiness and peace. And what I actually feel is overwhelmed, anxious, and sometimes gratitude, right? And oftentimes all three of them are negative. They're like, and burnout, right? Like it'll just be three negative things. And we have this story in our mind that we want to avoid all of these negative feelings. And as it turns out, many of the positive things that we experience in life actually come as a result of negative feelings, right? And so we talk about in coaching, we talk a lot about this, because anytime that you think about your career, right? The first time that, you're a plastic surgeon, the first time you operated on somebody as an attending physician, the first time you held clinic, right? You were probably nervous.
Terrified.
Right? You're terrified. But what you want is on the other side of that negative experience. And so if you're unwilling to feel that negative feeling and to operate not in spite of it, but because of it, to operate through it and with it, you can't get to the things you want in life.
Mm-hmm.
And so many people are sitting there burned out, overwhelmed, hate their career in medicine, or maybe you're sitting in your car and you're dreading your next shift, wishing that you didn't have to go in, or you're having trouble falling asleep on a Sunday because Monday is coming.
Mm-hmm.
Like, if you don't realize what that feeling is that's driving all of that and actually deal with it and emotionally process it, then you're just going to be on autopilot. And that's how you end up with, turning to other things that aren't necessarily going to accomplish your goals. And so I feel like that emotional processing piece, which I talk specifically about in the book and go into more detail,
Yeah.
is a huge part of this.
Yeah, totally agree. And that was something, even I feel like I've sort of flirted around that concept, but I hadn't kind of had it distilled down like that. And that was for me such a huge takeaway, and something like reading it, I was like, oh my God, yeah, that totally, like, that just happened to me a little bit ago. And so I do find myself really frequently trying intentionally to recognize that construct. So I use the example in the book of like driving a car and someone cuts you off. Like literally that happened to me since then, and I'm just like, all right, like, kind of I'll let people read that anecdote, but kind of handle it the same way. Or like when my kids are going crazy and I just feel totally overwhelmed, and in the past would have snapped at them or something like that, to even within the medical setting. So yeah, that was so helpful. And then we won't go into this, but for people reading, you go into the concept of buffering and the way we do that with our phones or other ways like drinking, or just overall things that are generally not healthy, and definitely something I think everyone struggles with. That helped me recognize the ways that I was buffering and address that. So definitely all awesome stuff, and can't recommend the book enough. I'm even going to have, my wife is not in medicine, but I think it's all applicable stuff. She's got it on her list to read. But quickly before we kind of wrap up, I want to talk about how people can reach you, obviously. But before that, maybe just briefly introduce the coaching that you do, because that is kind of a natural continuance of this book, and something that is obviously helping a lot of physicians.
Yeah. So, the program that I run is called the Alpha Coaching Experience because it's kind of people's first step into coaching a lot of the time. And yeah, so we basically help doctors that, for really two reasons. The two most common reasons people come to the program is that they're burned out, hence the name of the book.
Mm-hmm.
And the second is that, they just aren't quite where they want to be. And they're thinking about making a career transition of some kind. That might be getting a new job or negotiating their current job. It might be going part-time, or finding something else that's out there to really kind of find that work-life balance and contentment that they're looking for. And
Mm-hmm.
so that program exists, and we basically teach people how to, create the time, the financial freedom, and the balance that they need in their life to practice medicine on their terms, to practice because they want to and not because they have to. And so that's the work that we do inside of the Alpha Coaching Experience. And it's been really pretty incredible work. I actually just got an email yesterday from a client that was in the program for like a year. And he was talking about how, after going through the program and, learning how to negotiate and how to stand up for himself and, really do the mindset work he needed to go into those tough conversations,
Mm-hmm.
that, his salary increased by 60% this year. And he's actually
Wow.
renegotiating the contract for his 8 partners, because they've actually built a model that's at more, more sustainable and creates
Yeah.
more revenue. And it's just cool getting, feedback like that. And, people saying, hey, I used to hate my job. And, now I'm actually pretty content where I am. And like, they didn't even change jobs.
Yeah.
Right. And we
Yeah.
have people that realize like, no, I'm totally being taken advantage of in this situation. I deserve better than this. And they go get new
Right.
jobs. But they do that after they make the diagnosis and figure out what the problem is first, before they, shotgun it and just try a
Yeah,
bunch of things that
exactly.
don't
And
fix
then
the
just end
problem.
up in the same situation somewhere
Yeah,
else.
it's a super
Yeah.
common story. People come in, they're like, yeah, actually why I'm here is because I've tried making changes and they didn't work. And it's like, well, I mean, that's like just throwing random medications at people and being like, I don't know why it's not fixing your medical problem, right? Like, we don't do that in medicine. Why should you do that with your life?
Yeah, exactly. Awesome. Um, well, definitely everyone check out the book Determined by Jimmy Turner. If you're interested in coaching, check out his Alpha Coaching Experience. And then if people are just interested in your general kind of thoughts, how can they best reach you?
Yeah. So, I mean, the best way to, kind of get into that is to listen to the Physician Philosopher podcast. Of course, you can go to thephysicianphilosopher.com, and then there's the book. I think the book's a super easy entry
Mm,
into a lot of this work that we're talking about.
awesome. Well, thanks so much, Jimmy, for all you're doing and for helping me and mentoring me. And I appreciate it. And we'll see what you do next. I'm excited.
Yeah, absolutely, Jordan. Thanks for chatting with me.
Of course.